Hi, everyone. Thank you for joining the Texas Housers COVID response call today. The end of the year is just 16 days away. And according to the Census Pulse survey, more than 1 in 10 adults in Texas are not confident that they can pay next month's rent or mortgage on time. Of the adults not current on their housing payment, 2 in 5 fear that eviction or foreclosure could be likely. That is more than 700,000 households in Texas. That is more than double the number of households in the city of Fort Worth, Texas. So today, we are talking about the connection between health and housing. Anyone who's worked on housing issues knows that a stable home is where it all starts. Opportunity, student achievement, job security, and of course, health. So on our panel today, we have 3 people who can provide their important perspectives about how housing stability is an important tool in fighting this pandemic and restoring health and safety in our communities. All of them have very impressive bios, and I can talk on and on about them and their credentials and accomplishments, but in the interest of time, I'll keep it brief. Dr. Gabe Schwartz is a social epidemiologist at UCSF. He and several other researchers released a preprint research paper recently. Gabe and his colleagues found that lifting eviction moratoriums is associated with increased COVID-19 cases and mortality. Kate Moore is Vice President of Strategic Planning and Partnerships at ECHO in Austin. That is the lead agency that plans and implements community-wide strategies to end homelessness in Austin and Travis County. And Diane Yentel is the president and CEO of the National Low-Income Housing Coalition. Since the start of the pandemic, the NLIHC has been the leading voice in pushing federal officials to provide emergency rental assistance, eviction and foreclosure protections, and emergency funds for homelessness service providers, among a lot of other policy recommendations. So thank you to the 3 of you for joining us. And if you're just hopping on the Zoom or watching on Facebook Live, we are just about to start the questioning session. So I think maybe let's set the scene a little bit. Diane, I want you to do that for us. What issues did low-income renters face before the pandemic, and what policies or lack of policies contributed to those issues?
Sure. Thanks, Christina, and thanks for having me. So to best understand the eviction challenges that we face right now, we have to recognize where we were even before COVID-19 came to our country. And that was in the midst of a severe affordable housing crisis, where we had a shortage of 7 million apartments affordable and available to the lowest income people. So another way of saying that same number is for every 10 of the lowest income renters, there were fewer than 4 apartments that were affordable and available to them. Because we had such a shortage of apartments for the lowest income people, we had nearly 10 million of the lowest income renters, very low income or extremely low income, who were paying at least half of their income towards rent each month. And many were paying much more, 60, 70, 80% of their income just to keep a roof over their heads. So when you have such limited income to begin with, and you're paying so much of it for your home, you're always one financial shock away from missing rent, facing eviction, and in worst cases, becoming homeless. So for many of these same renters, the coronavirus is that financial shock. They've lost jobs, they've lost hours at work, they've lost wages, and it's harder than ever for them to cobble together what they need to make rent. And as far as policies that were in place before and during COVID that got us here as well is, we have a system in our country where only 1 in every 4 households who needs housing assistance and is eligible for it receives any. So 75% of people who need housing assistance don't get any. And it's only the lucky 25% who win what is essentially a housing lottery system in our country. So, if we had a housing safety net to catch people when they fall off of any kind of financial cliff, but especially one like that related to COVID-19, we wouldn't be in facing this tremendous eviction crisis that we are right now. Christina, you're on mute.
Am I still on mute? No, I'm not. Okay, great. It's clear that so many people were living on the edge, were living in precarious housing situations, as you mentioned, Diane. So Kate, I want to ask you, how do families living so close to the edge, so close to poverty, how do they become homeless?
So I think Diane captured it really well. You know, we have before COVID a situation where so many households are living in poverty. We have growing income inequality in our country. Many households are underemployed or unemployed. So with the lack of affordable housing, matching up with the stagnant incomes in our country, you have people who are one financial crisis potentially away from losing their housing. That doesn't always mean that people will fall into homelessness. It partially depends on the social safety nets and the family safety nets they may have. So some people may end up being doubled up or tripled up. Other people, will fall into homelessness. I also want to point out the systemic racism that goes along with this, with homelessness. We know that Black and African American citizens have been overrepresented in the US population experiencing homelessness, comprising of 40% of the total US homeless population, but only 13% of the overall population. Locally in Austin, we see similar statistics. So we know that Black or African American households comprise 35% of our homeless population, but only 8% of our Travis County population. And, we can assume that a lot of this is to do with the lack of equal access to housing, whether that's historic redlining, segregation, discrimination, lack of equal access to healthcare, and overcriminalization. So there's also a racial equity piece that we're dealing with.
Gabe, I want to turn to you now. You are a social epidemiologist studying evictions. So how did you end up studying evictions as a public health issue?
So I'm representing a team of sort of diverse researchers. Some of us are housing lawyers, some of us are epidemiologists. And so we come to that work from different perspectives. I started doing this work because I spent some time as a health advocate at a low-income clinic for families with children. And so many of the health problems those families faced stemmed fundamentally from a lack of availability of housing, of affordable housing, of facing eviction. And yet in the research literature, there really isn't their voice being represented in formal investigations of what those things like eviction and lack of stable housing do to families. But we know that housing is a bedrock of health, right? Most obviously, it provides shelter and physical safety and heat. It's also an enabler of other health activities that keep you healthy. So let's say you're trying to manage diabetes. Do you have a place to store and cook healthy food? Do you have a refrigerator where you can safely store and take your insulin? Can you stay in a neighborhood where you have a relationship with a primary healthcare provider who knows you and knows your unique health circumstances and who you trust? And we know housing means something to people, right? Having a place of your own where you can let your guard down and not have to worry about the stresses of the outside world is incredibly important to people's mental well-being. And so the flip side of that means that a lack of housing means a lack of safety, a lack of shelter, also a lack of the ability to do many of the health activities doctors would prescribe to you to stay healthy, and an incredible burden on mental health and mental bandwidth. And so that's sort of the perspective we've been bringing to our research.
I want to turn back to Kate. Can you talk about how homelessness affects someone's health?
Sure. So I would really agree with Gabe. I mean, one of the things that has become incredibly apparent during this pandemic is housing is healthcare. And that without it, it's really hard to deal with a pandemic hitting our community. People experiencing homelessness tend to be older. They tend to have health conditions that make the virus more dangerous. And they don't have some of the basic resources that you and I may have to protect themselves from the virus, such as being able to wash their hands or to socially distance. So it's really affected health. We looked at one study from the University of Pennsylvania and UCLA that estimates people experiencing homelessness are twice as likely to be hospitalized with COVID-19, 2 to 4 times as likely to need critical care, and 2 to 3 times as likely to die from COVID-19. And so it's taken a big toll on our homeless population.
Diane, besides the pandemic, what other connections have you seen between housing and health in your work with NLIHC and otherwise?
Well, so many that Gabe and Kate laid out really well. I mean, the reason why the increased degree of illness and potential death from COVID-19 is so severe for people experiencing homelessness is because they have so many underlying illnesses. And some of those underlying illnesses are what led them ultimately to homelessness. Many times those illnesses developed because they are homeless. So, sleeping in encampments and congregate shelters is very unhealthy. And the longer it continues, the more harm it does to individuals, certainly. And, evictions can be profoundly traumatizing and destabilizing and do long-term harm to people's health, their mental health and their physical health, as Gabe laid out. And it leads to all sorts of health consequences like asthma or diabetes, also to mental health challenges, to long-term depression, to suicide. These are all like very clear links, and maybe the more obvious immediate links between health and evictions. But also, having a single eviction filing on somebody's record makes it very difficult for them to find adequate housing in the future, because landlords, they've got a record now and landlords don't want to rent to them. And so they end up having to go to sometimes more dilapidated housing in sometimes more challenged neighborhoods, and both of those to overcrowded housing. All three of those outcomes also can lead to harmful health consequences.
Gabe, what are the overall findings of your preprint paper, and what are the findings in Texas? And also in general, what sort of impact did the moratoria have?
So many co-authors and I have just put out sort of as an emergency preprint. So before it was peer reviewed, because this CDC moratorium, which we'll get into, is sort of about to expire, a study where we tracked 44 states that put into place some level of moratorium on evictions. And that varied from place to place, from a moratorium even on filing, or just a moratorium on the actual carrying out of the eviction itself. So we followed them as 27 of them lifted those moratoria, and then tracked how that moved with COVID incidence, so the number of cases that were happening, and COVID mortality, the number of deaths. And following on Kate and Diane's comments, right, it's not just that it protected individual people from being evicted, from doubling up, from becoming homeless, from sleeping in shelters. It also protected the communities that those people are part of, right? If people are transferring COVID to one another and are higher risk because of overcrowding, because of having to sleep in shelters, and then they go out into the world, if they become infected and go to their jobs, to the grocery store, to a food line, that then means there is greater community spread, often before people even know that they're sick. And so what we found is that when eviction moratoriums expired all across the country through about September, it translated to over 400,000 excess cases, and somewhere between 8,000 and 12,000 additional COVID-19 deaths. And for Texas, because it's a very large state and because it lifted its moratorium very early, that means that just through September, about 150,000 extra cases and as many as 4,500 deaths were attributable to the lifting of the eviction moratorium. And that cases, 150,000 cases is like the population of McAllen, Texas, right? So it's a very large number of people and an even larger number of families and communities who are affected by that suffering.
Yeah, I want to highlight this point, and that is tens of thousands of people who could have stayed healthy, according to your research, and thousands of deaths that could have been prevented. So, that's sort of the thesis of this whole talk is that this is all, housing is just such a preventative key for health and wellness. So thanks for stating that, Gabe, and for contextualizing it with a Texas city. I appreciate that. Kate, can you explain the difference between sheltered and unsheltered homelessness and how the pandemic has impacted that?
Sure. So essentially sheltered is typically what you would think of as an emergency shelter. And in most communities, that can be a congregate setting. So you might have seen pictures of rooms with bunk beds in them, for instance. And so that is typically what a typical setting for an emergency shelter in most communities. And by the definition from the U.S. Department of Housing and Urban Development, or HUD, that is an emergency shelter is a type of housing intervention. And it's the type of housing intervention where you typically don't have any kind of like pre-qualifications to getting in. You just come in and you need a place to sleep. And if they have room, typically you can come in and stay. And often communities will have shelters that are targeted towards singles and some that are targeted towards households. Most communities also have shelters that are targeted towards survivors of domestic violence and human trafficking, for instance. So that shelter is typically in a congregate type of setting, not always, but sometimes. Then unsheltered is people who are not in a shelter. It's what they're living under the bridge, they're living in the woods, they've found some place that is not meant for people to live and found a way to live there. And our community, we have thousands of people who are living unsheltered currently. We also know we have a lack of affordable housing, and we have a limited capacity of emergency shelter. The pandemic for our emergency shelters has required us to really reduce our capacity because we need to follow CDC guidelines, which requires more social distancing in order to keep both people who are residing there and also the staff safe. So it's the pandemic, I'm sure across the country, has required a lot of people to reduce their congregate shelter capacity.
Diane, you have eyes and ears about the housing crisis in this country. You have it all over the state with the NLIHC state partners, and you've just been the NLIHC has been keeping very good track of what's happening on the ground, and kind of using your platform to tell everyone. I want you to talk about how the pandemic has exacerbated housing issues, such as the ones Kate talked about, and otherwise too.
Sorry. A few things I would highlight. One is as I mentioned earlier, we had tremendous challenges. Low-income renters had tremendous challenges pre-COVID, and that's only been unveiled, made clear, and exacerbated during the pandemic. So early on, there were a patchwork of protections and resources put into place, like state, local, federal eviction moratoriums, expanded unemployment insurance, a stimulus check, very limited emergency rental assistance. So at this point, the vast majority of those protections have expired. The resources have been depleted, and the only remaining protection that is keeping renters housed is the CDC eviction moratorium. By the time that is scheduled to expire on December 31st, there are estimates that renters will owe anywhere between $30 billion and $70 billion in back rent, clearly more than they can ever pay off. And at that point, with virtually no protections remaining to keep them housed. Now, we have seen there were some emergency rental assistance programs created with resources from the CARES Act, and we've been tracking all of them. Nationally, at last count, we were up to 518 emergency rental assistance programs. And there's a wide variance in how effective they are and how they're able to get funds to people who need it the most. I will say about 30% of those programs have already shut down. And Houston is often held up as the one that shut down in, I think, 90 minutes after opening because the demand was so extraordinary and the resources were depleted. But there's also a wide variance in how those programs are administered, who they can help, and who they're not helping. A lot of lessons for us to learn about how to better implement emergency rental assistance programs in the future. But another thing that I want to just highlight, sort of building off of what Kate was sharing on sheltered and unsheltered people, is that yes, early on in the pandemic, homeless shelter providers responded really heroically and did tremendous work to keep people experiencing homelessness safe, primarily through deconcentrating congregate shelters, literally cutting in half the number of beds that were available to people experiencing homelessness so they could spread out the ones that remained. Now, here we are 9 months into the pandemic, at a time when many of those communities would be opening up their winter shelter beds, and they have little to no resources and in some cases space to do it. So when we think about the existing population of people experiencing homelessness and meeting their needs and how challenged shelter providers are, the possibility of adding potentially tens of millions more people in need of shelter or services is just an impossible scenario for everybody, and one we have to do everything we can to avoid. And just one more quick thing is that another way that people have deconcentrated shelters or assisted people who were sleeping in encampments was to move them into hotel rooms with funding that was reimbursed by FEMA. And that was a good idea to get people into a space where they could isolate or quarantine if needed. Now, those same communities are facing the impossible scenario of what's next for those individuals and those families. And we have, again, because of our shredded social safety net, we have put mayors and providers in the position of considering whether they should have people move back to the sidewalk they were sleeping on before the pandemic hit our country, which is clearly, an atrocious and unacceptable outcome.
Kate, I wanted to give you a chance to expand upon what Diane said, and that's that homeless service providers had to put on this heroic effort to meet the need when this pandemic started. And then again, 9 months later, they're still trying to keep up with the demand, with the possibility of a demand like we've never seen.
Yeah, I can speak to what we've done here in Austin is that a tremendous effort was put forward by our providers, by our city, and we were able to put up 5 hotels where we leased or the city procured in some way those units, and we created a medical staffing where we worked with our local medical providers to determine who was at the highest risk for COVID-19, who was currently unsheltered and could have access to those units. We also, as a community, stood up an isolation facility for people who, including for people who were unsheltered, who were exposed or who were COVID-19 positive, where they could have access to intensive medical services that they needed. But I can say that it has been, speaking to Diane's point about, what do we do now? As we look at the long-term impacts of the people that are in those hotel units, we also are thinking about, we have hundreds of people that never got into the units who could have really used, who were also medically vulnerable, and just we didn't have enough for them. But we've made a commitment as a city that we will not release people into unsheltered homelessness from our protective lodging, which is what we're calling our hotel units, is pro lodges, protective lodging. And we are building up a homeless response system, which has units of intervention called rapid rehousing and permanent supportive housing. And we are creating essentially a tie-in of a priority for our CARES Act funding. And then other providers have dedicated funding as well, so that we are matching those housing programs to individuals so that they can exit out of the protective lodging. It has been a massive effort for our community to staff that, to do that work. But we're committed to what Diane was talking about, that we don't want to be in the position of returning somebody back to the corner where they were located.
Gabe, so we're talking about potentially thousands more people ending up on the streets, and that's like the worst case scenario, aside from greater cases of COVID, greater hospitalizations, and then mortality. So I want to talk to you about your study. How do you show that the deaths that you talked about, the 4,500 in Texas, how can you tell that those are related to evictions? A lot of people have talked about how the people who are hospitalized and the people who end up dying because of COVID complications have underlying conditions. So how did you make that connection?
So there's sort of two ways to answer this question. One of them is, I think, a strength of studying state moratoriums is that all these different states lifted those moratoriums at different times over the course of a number of months, at different phases of the pandemic, with different state policies moving in and out of play. And so we're able to isolate sort of what happened consistently when states lifted their moratorium, even if in any given case, other things were happening at the state level. And it tracks with another study that was a sort of modeling what would happen if evicted people got kicked out of their homes and then had to double up with their relatives, often elderly relatives, and then faced a home situation in which many more adults in the house are leaving to go to work, in which it's much harder to separate or isolate if one of you gets sick, or has to quarantine for 2 weeks, which is a really long time to quarantine in crowded housing. And what they found is it's absolutely true that there are high risk scenarios for people who had pre-existing conditions, for people in nursing homes. But the primary thing that determines whether they get sick in the first place is their exposure level, right? You have to get exposed in order to die. So think about a nursing home. There are 6 or 7 people, say, visiting every day. There are all of the nurses who work in that nursing home, who go home to their families, who have to live in the world and come back. And if there is massive community transmission driven by people not having a place to be able to shelter, driven by people being in either congregate living facilities where it's difficult to be able to distance, as we've talked about, if they're in an encampment in which it's very difficult to access sanitation, hand washing, basic PPE, if they're doubled up, well, that means that those 6 people visiting that nursing home and all of the nurses are much more likely to have been infected out in the world. And therefore, it's much more likely that an outbreak happens in, say, a nursing facility or another context in which people are really high risk. So we think it's important not just to emphasize that this is a problem for the people with the least money, for the most struggling renters, for people who are experiencing homelessness. This is a problem for everyone. It raises everyone's risk. And so you can ignore people if you want, but that it is a community level problem, a state level problem. It is not just a problem of people in homelessness shelters and the people trying to keep those homeless shelters running.
So I'm going to pause at this moment to take a few questions from the audience, then we'll kind of get back to the programming. But someone in our chat has asked, as a quick follow-up to Diane's comment about Houston rental assistance being allocated in 90 minutes in the spring, it's true. Someone would like to clarify that more funding has since been allocated in the Houston area. And there's a link in the chat. Harris County residents are encouraged to apply for COVID rental assistance here. So, so important clarification. So thank you for doing that. Okay, let's move on. I want to talk about what 2021 could look like. We have been, you know, the general conversation in media and just among advocates, service providers, government officials, we're all talking about this tsunami of evictions and a spike in homelessness that could be happening. We've been talking about this for months and it hasn't quite happened, but we've continued to sound the alarm. That might change in January, where it could happen if nothing is done. So I'll start with you, Kate. How have we seen the pandemic impact service providers, and especially how might that continue into 2021?
Sure. So it's had a really large impact on our service providers, as probably many of you that are watching, right? Many of us, if we can, we've gone to working remotely. Like I'm working right now out of my home. Service providers, if they can, are trying to work remotely. It creates a big challenge, though, as you can imagine, if you are trying to connect with clients who may or may not have cell phones, who may not have a stable place where they're staying, it can be really a big challenge. And also, if you do have designated staff, who, for instance, are doing outreach and going out and visiting unsheltered populations, if they become exposed, for instance, they may have to quarantine for 2 weeks, and that it's just a challenge to fill those gaps for those service providers. So they've definitely been the heroes on our front line in our community. We're very grateful for all that they're doing, and it's going to continue to be a challenge in going into 2021.
Diane, what are your biggest concerns for 2021?
Well, Christina, you mentioned how the idea of an eviction tsunami hasn't been realized yet. That's only because there have been resources available and protections in place. And again, those, the expanded unemployment insurance has been expired since summer. Stimulus checks are long since spent. And the last remaining protection to keep people housed is the CDC eviction moratorium, which is flawed and has holes, and renters in some places, I think Texas is one of the hottest spots in the country, where evictions are proceeding despite the moratorium. And still, generally speaking, the moratorium is doing what it was intended to do, which is keep tens of millions of people who would otherwise lose their homes housed during the pandemic. So that expires on December 31st. And again, by then, renters will owe far more in debt than they can possibly pay off. And because of some changes that were made to the CDC eviction moratorium along the way by the CDC, countering their own moratorium order, landlords and courts can take all the steps in an eviction up to actually removing somebody from their home, which can't happen until the moratorium expires. That means when it does, if it does, that not only will we see a flood and yes, a tsunami of evictions across the country, it means it will happen very quickly, because in many places, all of the steps have already been taken. So it's just a formality at that point to actually remove somebody from their home. So that's my greatest fear. It is not an exaggeration to say that if the federal government does not intervene, we are looking at the very real possibility of tens of millions of people losing their homes during the winter, during the height of COVID-19, with catastrophic outcomes, for kids and families and communities, and for our country's ability to contain the pandemic. Because as we heard from Gabe and his co-authors, and increased evictions will lead to increased spread of and potentially deaths from COVID-19. So we all have to be doing everything we can to prevent that outcome. And there are steps that we can take, and there are possible different scenarios, but only if we act.
Yeah. one of the things that's happening in the news right now is that a vaccine, people are starting to get their first doses of the vaccine, healthcare workers especially. And I've seen a lot of researchers say, you know, that's great, that's the light at the end of the tunnel, but if the important thing about the vaccine is that we can't give it that much work to do. It will not be effective if it has a ton of work to do. In other words, if so many people have the virus, the vaccine will lose its effectiveness. So the first thing we do, the vaccine has to be coupled with us taking those important measures. So, you know, Gabe, I want to turn to you and ask you, what is your team thinking is going to happen once the CDC moratorium is lifted?
So I unfortunately want to echo, I think, the realistic pessimism of the rest of the panelists, in part because we've seen the eviction lab that tracks evictions around the country has shown large spikes in evictions immediately after state moratoriums end. And that's mostly true in the states where landlords were able to go through the entire process of eviction up until the eviction itself. Whereas places where you couldn't even file an eviction, we saw a much larger delay between when the moratorium expired and when cases spiked, in part because it takes time to evict people. And that time means renters have more time to either get together money to try to work out a payment plan, to try to safely combine households instead of having to sort of overnight move into a family member's home. And so we're worried that if we face a huge number of evictions when the CDC moratorium ends at the most dangerous time of the year for COVID transmission, which is in the middle of the winter, when community transmission is so much higher that even figures like ours, like over 400,000 cases, 10,000 deaths, are going to pale in comparison potentially to what we would see when transmission is so much higher around the country. And we're worried that will hinder other attempts to get this pandemic under control. If you're not willing to house people safely and you're willing to allow community spread to rip through communities, especially the parts of our communities that have the fewest resources, that's going to mean more cases, more community transmission, and an even longer pandemic with even more severe economic consequences. So even if you don't care as a policymaker about people's lives now, it is going to take a toll on the country's ability to get back on its feet generally. But I also want to emphasize that the CDC moratorium really needs to be strengthened as much as possible, not just maintained. So currently, it's a sort of bureaucratic process. Renters have to know that they're protected by this. They have to be able to declare officially in court that the reason that they are facing eviction is because of COVID. And so a few weeks after the CDC moratorium went into place, NPR did a story in Houston, and they watched about 100 eviction proceedings. And in only one of those proceedings was someone able to successfully use the CDC's moratorium to prevent their eviction. And hopefully it's gotten better since then as sort of word has spread and courts have gotten used to that process, and housing organizations have been able to educate people. But if we really want to prevent transmission from evictions and from homelessness, we need to extend this moratorium, and we need to make it stronger, and we need to make sure that every renter has the ability to easily use this when they're eligible. So we're worried, but we have a narrow window in which we actually can meaningfully change the game, especially if the federal government steps in to provide rent relief, because otherwise, if you extend the moratorium, you're just extending the period in which rent is going to pile up and putting off this wave of evictions. It's going to make it harder to get the pandemic under control. You're not actually preventing it from happening.
I think this is another good time to pause for some questions from the audience. There's a question from someone on our Facebook Live feed. Is there a concerted national housing campaign around the eviction crisis? I think this one's for you, Diane.
Yes, there is. Yes, there is. The thing about this eviction crisis that we're facing right now, it's not only completely predictable, as we and many others have been predicting it for over 9 months, it's entirely preventable, but preventing it requires action by the federal government. And so for over 9 months, we have been calling for 3 solutions. One, a uniform, broad moratorium on all evictions for non-payment of rent for the duration of the pandemic. The very least the federal government ought to do in the middle of a global public health emergency is assure each of us that we're not going to lose our homes in the middle of it. But eviction moratoriums on their own aren't enough, because eventually they do expire and back rent is owed, and low-income renters are no more able to pay it then than they are now, or they were at the beginning of the pandemic. So the eviction moratoriums have to be paired with substantial emergency rental assistance. So we have been calling for at least $100 billion in emergency rental assistance. And homeless shelter and service providers need another $11.5 billion to keep people who are experiencing homelessness safe and healthy and alive, and get them housed as quickly as possible. So each of these solutions have passed the US House of Representatives now, not just once, not twice, but 3 times. There's multiple bills in the Senate. There's unanimous Democratic support. There is growing Republican support. And negotiations are back on track. And we are, once again, we have these solutions so close within our grasp. But we've been here before. There's been 2 other times over the last 9 months when we were very close. There were negotiations happening, and rental assistance and eviction prevention were on the table in the negotiations. And then the overall deal fell apart. So where we are right now is there's a bipartisan group in the Senate and the House who have put forward compromise COVID relief legislation. It includes $25 billion in emergency rental assistance, and it includes an extension of the CDC eviction moratorium through the end of January. So for all the reasons we just talked about, that's clearly not enough. $25 billion isn't going to pay the $70 billion in back rent. January 31st is just around the corner. But I will say that we will take this deal if we can get it done this year, because it will make a difference and it will keep people housed. And we will live to fight another day and prevent this eviction tsunami. So we are pushing, it's all happens now. It's this week or not this year. So we're working on ensuring that it does happen. But we're also not counting on Congress to muster up the courage to do what needs to be done, because they haven't been able to do it yet. So we also have been urging the CDC to extend its own eviction moratorium, which they have the authority to do and they could do today. So we are, and to Gabe's point, we are encouraging them, urging them to extend it, to improve it, and to enforce it. Because there are actually really steep penalties for landlords who unlawfully evict under the moratorium, but nobody's enforcing that, so they're getting away with it. So we have been circulating a national sign-on letter. Today's actually the last day for organizations to sign up. We're up to almost 1,200 organizations that are joining us, and we're going to send that letter to the CDC tomorrow. We're also urging governors and mayors not to wait on the federal government to protect renters in your communities. Governors and mayors should be establishing their own state and citywide eviction moratoriums right now to protect renters next month. And then finally, we are also working with the transition team of President-elect Biden and urging and pressuring and encouraging him to be ready to sign an executive order on day 1 on January 30th for an improved and enforced and extended eviction moratorium.
Thank you for that. I think you answered another question that was in the chat, so I'll move on to this other question. For each panelist, or for anyone who would like to answer, what are the crucial elements of an effective eviction prevention program, and how would you suggest rent relief be structured and funded? I think this is an important question, to your point, Diane, for the mayors and city staff and state staff who are trying to meet the moment. So if any of you would like to answer, that would be great.
I can jump in just from a local perspective of mine. I think that what we need to ensure is that rental assistance, at least part of the rental assistance, is targeted towards extremely low income households and households who have previously experienced homelessness. For instance, we've designed a prevention program here in the Austin community that is targeted to people who have exited a permanent housing program. So they were experiencing homelessness, they stabilized through a housing intervention, and now they're living without that intervention successfully. We know that those folks are really vulnerable to eviction, and we want to make sure that we can tie them into rental assistance. And I think that that's true across the board. We need to make sure that we have enough, rental assistance. Diane, I so appreciate the work of the coalition and what you guys are doing and pushing for the federal government, because we just desperately on the local level need more money to meet this need. We know the tsunami is coming, and we've been trying to think about how can we best keep it from hitting our community. And then I would just say too, we need to really think about the lessons learned and create more permanent affordable housing options for people, more permanent supportive housing, more Section 8 vouchers, and more housing choice vouchers. We need to do better as a nation at housing our most vulnerable. So that's what I would see.
And I would add to that one, just to underscore the importance of Kate's point about income targeting, and not only for the reason she shared and for the obvious reason that the lowest income people are likely to be most immediately at risk of being evicted, but also for the racial equity implications of it. Just in targeting extremely low income people with your resources, you are advancing racial equity because of our decades of systemic racism, and as Kate mentioned early on, people of color are disproportionately likely to be extremely low income and disproportionately likely to be experiencing homelessness. And I would also say that beyond the income targeting, which is critical, as little additional requirements or documentation as possible, because any additional documentation, any intake interviews that are required, reams of paperwork that has to be presented, that one, it has a chilling effect, and it automatically removes some people from getting the assistance they need, and it slows things down. And we've seen, as I said, we have been tracking 518 programs across the country. Most places have done a really good job. They're getting the money out fast to the people who need it. The ones who aren't, there's two problems. One is lack of capacity. There are places where it's one or two staff trying to manage just a deluge of applications, and there's literally not enough hours in the day to get through them. That's one problem. The other problem is program administrators really overburdening themselves and applicants with bureaucracy. So not exaggerating, and this is an outlier, but there's one example of a community that has a 55-page application and a 1-hour intake interview required for each applicant. So not surprisingly, people are not getting assistance very fast. And look, we all know, like, the facts are very clear. The data is very clear. People are struggling. So let's believe them when they come to us and say they need help. Let's believe them and give them the help that they need. And knowing that we are not going to have enough resources to help everybody who needs it. Let's make sure we're targeting the people who need it the most.
I just want to echo, and I feel so grateful for Kate and Diane's work for informing this so deeply. The early, easy, and supportive are the buzzwords. In part, a friend of mine was helping folks access unemployment benefits in the early months of the pandemic. And even things like, you have to print out this piece of paper, like print where? With the printer I don't have at home, in the house that I don't have, in the library that's not open. Like, it just, very small things like, can someone with just a smartphone access this form, submit it with clear language that's not ambiguous, and have that very small action by them be able to quickly protect them, I think is the formula. Because if you don't do that, the best intentioned program in the world is, as Diane and Kate were saying, it won't even be logistically feasible.
We've been talking a lot about a very bleak future if nothing is done. Something that I have found a silver lining, especially in Texas, is that Texas has always been a very horrible place for renters. There are not a lot of renter protections. The silver lining of kind of where we are is that people are starting to see that renter protections are possible, they are needed, and they will help people stay housed. And so from my perspective as a housing advocate in Texas, this time is showing us what's possible because it's telling us what's needed. And we're trying to meet that need. However, we fall short, of course. I want to end with each of you talking about something that is giving you hope in this moment. Oh God, you guys, it's really that bleak.
Yeah, the vaccine gives me hope. I mean, thank goodness that there is a light at the end of the tunnel of some sort. But the incoming administration gives me hope too. I mean, it will not be an easy road. And I think all of the big ideas that many of us wish we could achieve in the short term aren't going to be possible because we still have a very divided Congress. But change is possible. And there are opportunities to advance real solutions in Congress and even beyond that to kind of rebuild and re-energize the spirit of HUD and the federal government's role in ensuring decent and accessible and affordable housing for everybody, and with a racial justice lens, to have an administration that recognizes racial inequities and the work we have ahead to remedy that. I mean, just that coming out of the last 4 years, is reason for hope. And I think the last 4 years has strengthened us as a movement for housing justice. Every battle we had to fight to defeat harmful proposals strengthened us. And now from this place of strength as a movement, we're going into this new year and this new administration with huge challenges, but real opportunities.
So I'm really hopeful for many of the things that Diane mentioned, the vaccine, the new administration, with eyes wide open about the challenges in front of us as well. On a local level, we see a microcosm of that. I'm hopeful about the coordination that I saw happening on a local level, for instance, around meeting the needs of unsheltered people experiencing homelessness. And I'm hopeful that will catalyze into helping us do even more as a community. I'm also hopeful that we will continue to see as a community and as a country that housing is healthcare, and that these two issues are tied, that housing is a human right and healthcare is a human right. And that if we don't have those as values as a community and as a country, that these crises will continue to hit us particularly hard as a country. So I'm hopeful that this situation has daylighted that for us and that we'll be able to take the action we need to prevent this from hitting us as hard next time.
Really agree with everyone. And I think that the specific thing giving me hope is that working people and working class communities are really firing on all cylinders all across the country, are establishing mutual aid organizations, are flexing political power. We've seen in city government in LA, for example, Nitya Raman, who is a really strong advocate for the rights of people experiencing homelessness and for the rights of people for affordable housing, was just elected to city council. And I think there is there are major wins in how these issues are being framed nationally, as well as sort of organizations coalescing around a real need for bold action. That incrementalism is really critical. We need to fix these sort of bureaucratic rules. And in the meantime, we need things like $112 billion because that is what's necessary to keep people safe. And coalescing around those values, I think, bodes well for the future, even if it means we have to wade through a bit of a swamp to get there.
Yeah, thank you all for mustering up those little pieces of hope. I really appreciate it. It's very needed now. For those of you watching from Texas and those of you who are moved to want to do something, Diane has mentioned a sign-on letter that the NLIHC has put together. So sign on to that letter. You can find it on their website, the National Low Income Housing Coalition. And then Texas Housers has another sign-on letter. As Diane has mentioned, we can't wait on Congress. We can't wait on the federal government. We have to have our state and local leaders act. So Texas Housers has written a letter to the Texas Supreme Court, so that asking for a moratorium, and to the governor, asking the governor to issue whatever kinds of protections and direct funds that he can put together. So join a few, I think something like 60 organizations in Texas have signed on to this letter. Join us in asking for that. But I would like to thank our panelists for joining us. We so appreciate this conversation. And you will find this on Facebook if you want to share it with your networks. It's on our Facebook page, so feel free to share it with everyone. Thank you so much.
Thank you.
Thanks.
Thank you.